OAB or overactive bladder is urinary urgency, often associated with urinary frequency as well as nocturia, with or without urinary incontinence, in the absence of any other pathology, and hence it is a diagnosis of exclusion. It is vitally important to exclude other illnesses or diseases that are quite similar or confusable. Let me just elaborate a little bit on individual characteristics of overactive bladder itself. Urinary urgency is a sudden compelling desire to pass urine that is difficult to defer. Urinary frequency is the need to pass urine more than 8 times a day. And lastly, nocturia is the need to wake up more than 1 time to pass urine at night. Incontinence is any involuntary leakage of urine, and incontinence that is associated with overactive bladder is different from the other subtypes of incontinence. The various subtypes of incontinence includes stress incontinence, mixed incontinence, urgency incontinence, as well as continuous incontinence, and these different subtypes have different root causes and hence needs to be treated separately. Overactive bladder is a diagnosis of exclusion, and hence it is essential to do a full physical test as well as do a relevant investigations or tests to exclude similar conditions such as urinary tract infections, stones, as well as cancers. We also ideally would like the patient to keep a special recording called a bladder diary, and that enables us to look at the patient's drinking habits and lifestyle and make necessary adjustments. Lastly, something special called the urodynamics test may be done, and this is only in those who have not responded to initial treatment or before we embark on further invasive management. Treatment options follow a step-ladder approach and start with conservative measures. Some examples of conservative measures include lifestyle changes, fluid modification, as well as pelvic floor exercises. So, for example, one should generally try to avoid excessive caffeine as well as alcohol when one has overactive bladder. Furthermore, medications can be used such as antimuscarinics or anticholinergics as well as beta-3 agonists, and these are 2 large group of medications. If someone has severe symptoms, then a combination of the medicines can be used as well. After medications, minimally invasive options are utilized for the treatment of overactive bladder, and there are 2 broad categories. It's either the injection of botulinum toxin into the bladder or nerve stimulation. With regards to the utilization of Botox injection into the bladder, this is usually done under local anesthesia in outpatient setting using a telescope or a cystoscope to access the bladder. This is a very successful treatment. It's 80% successful and effective most of the time with minimal side effects such as bleeding, infection, as well as retention, and the medicine works to relax the bladder and reduce abnormal bladder contractions. Nerve stimulation consists of 2 types, either PTNS or SNS. PTNS, or percutaneous tibial nerve stimulation, is a once-a-week treatment for up to 12 weeks. What happens is that a small needle, very similar to an acupuncture needle, is placed on the inside of the ankle, and that is connected up to a small generator as you see here. Now, this generator is able to generate low currents and stimulate the posterior tibial nerve, which connects up to the bladder sacral nerve roots. This treatment is relatively successful in up to 60 to 70% of the patients in reducing their symptoms and can be done easily in outpatient setting. Sacral nerve stimulation, or SNS, is equivalent to implanting a new pacemaker for the bladder. This treatment takes place in 2 stages. The first stage consists of the test phase, where a small test wire is placed next to the S3 nerve root or the sacral nerve root and stimulates the nerve that supplies the bladder. If successful, then the second stage takes place where an implantable generator such as this is then placed into a back pocket near to the wire, and hence it is able to stimulate the sacral nerve root for up to 24 hours a day for maximal efficacy. In summary, overactive bladder or OAB is a condition that is characterized by urinary urgency, and there are many treatment options available. Each treatment option should be tailored to the patient's individual needs, and certainly I think we should need to seek a urologist's opinion for the discussion of the different types of specialized management.